Now, in its recently released annual report, the Global Health Technologies Coalition, or GHTC, says the United States needs to provide sufficient and stable funding in the global health arena in research and development to better respond to health crises like Zika and Ebola. I sat down with Erin Will Morton, the GHTC Coalition Director, to discuss the issue.
We were relieved to see the end of Ebola. And of course, we were all very surprised when Zika happened. And I think when we fought Ebola and responded as quickly as we did and efficiently as we did, we didn't know what was going to be next. And it was shocking when we found out about Zika. And unfortunately, we're in the same position where we don't have the tools that we need to fight Zika. There's no drug to treat the virus. There's no vaccine to prevent it. And the diagnostic tools are inadequate.
GHTC released its annual report talking about the issue.
This year's report really looked at the need for sustained investments in research and development to reach the goals that we've set for ourselves in global health. You know, epidemics like Zika and Ebola are only part of the global health challenge that we face. We have ongoing threats like HIV/AIDS, malaria, TB, and these diseases need ongoing research and development, sustained investments in R&D to ensure that we have the tools ready to fight epidemics like Zika and Ebola, but also to address the sort of the ongoing global health threats that we continue to face.
Any lessons learned from Ebola that can be used with Zika?
I think we did learn some lessons from Ebola, and one of the things that the report points to is the sort of need for coordination among the U.S. agencies as part of the response to Ebola. We saw them work really effectively together, the CDC, the Department of Defense, USAID, to develop what was called the Ebola Grand Challenge, to really ask people to come together around the development of new tools and new technologies that could be used to fight the Ebola outbreak. And that coordination was really key in the U.S. government's response to the outbreak.
President Obama proposed recently to move the remaining funds from Ebola to tackle Zika. But in a perfect world, where would the money come from?
Well, we need new money. We can't move money from Ebola to fight Zika. You know, that's just not an option. We're not finished with Ebola. It's not done. We haven't solved the problem or the crisis completely. And so we really do need new money to address something like Zika. It's asking too much of U.S. government agencies to move money from one epidemic to another. We're just, taking money from one public health threat to fight something else, and that's not the best way to do research and development.
But where should the money come from?
The U.S. government is the number one investor in global health research and development, and it has to continue to be a leader in that space, and we have to continue to make those investments. And if we make them long-term and sustain those investments, it won't be as expensive as responding to emergencies like Zika and Ebola, where we have to put much more money forward immediately.
We are in an election year. What will be something that will resonate?
I think we want to hear from the candidates that they support the understanding for a need for R&D, and there's an importance for the U.S., the leader of the U.S., to understand the important role that the U.S. plays in leading in science and in research and development, and those are the kinds of things you want to hear from a candidate who is going to continue that message and understand the importance of U.S. leadership in global health research and development.
Now let's talk policy in terms of the policy actions that the U.S. government must take to accelerate development of urgently needed tools.
Well, the report really looks at three different big goals that we think the U.S. government could take on in terms of moving research and development forward. The first is really sustained investment and sustained funding. We can't solve our global health crises without public funding. And public funding is not enough. We need some sort of new incentives or new ways to incentivize global health research and development. We need to be encouraging private sector to be involved in research and development. The second thing is really the coordination that I talked about, that the U.S. agencies coordinating with one another and outside of the U.S. government as well at the multilateral level. And the third is really the sort of strengthening of regulatory capacity. Research and development is about developing new tools and technologies, but we need to ensure that they're safe and effective when they get into the hands of people who are going to be using them.
Have you seen progress in the reports?
Well, we have seen progress in global health R&D, and one of the things that the report points to this year, which is pretty exciting, is that we have almost 500 global health products in the pipeline. And just under 10 years ago, we had only 200. And so we've really seen progress in that way. We've seen new developments. We've seen new tools and technologies come into the pipeline. And so we are making progress. But there's a lot of concern that if we cut back funding or funding doesn't continue to grow, we won't be able to continue that progress.
And that's our health report for today. To stay in touch, well, find me on Twitter at Linord Moudou. Esther?
Thanks, Lino. And be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.